Hello everyone, welcome back to my channel. If you're new here, hi, my name is Charlotte. I'm a registered nurse and today I'm very excited to be sharing with you the 5th episode of Nursing 101, the series where I share with you skills and topic reviews that you will come across in nursing school. Today we're going to be covering a crucial skill which every nurse and health practitioner needs to know how to do, and that is how to take a respiratory rate. All of the information that I use in this video is to be found in the description box, which I have linked everything that I use just so that you can go through it and have a read at your own leisure. Before we get into everything, don't forget to like, subscribe, do all of that good stuff, but for now let's dive right in. So let's start with a couple of key pieces of vocabulary. So the first thing that you should know is tachypnea, which is very rapid shallow breathing or a raised respiratory rate. On the other hand, we have bradypnea. I cannot say that word, I will write it on the screen, but that is a really slow, decreased respiratory rate. And finally, another thing that is handy to know is sleep apnea, which is when you're sleeping, your breathing repeatedly stops and starts. So why do we take respiratory rates? I mean, firstly, and the most obvious thing is that it gives us a very clear picture of what is going on with our patient, and it helps us to tailor and create effective healthcare plans for the patient as well. And secondly, it also is a really good way to help us to track and monitor if a patient's condition is changing or if they're starting to deteriorate. So for example, conditions with metabolic acidosis will increase respiratory rate, whereas conditions with metabolic alkalosis will do the opposite and decrease respiratory rate. Congestive heart failure is going to affect the respiratory rate, as are brain injuries where the intracranial pressure is starting to increase. And also if you've got a patient who's taken certain drugs or medications such as opioids, it's also going to affect their respiratory rate. So as you can see, there are a lot of different reasons and conditions why somebody's breathing might change, and therefore it's really important so that we can monitor any changes and be prepared for if the patient starts to quickly deteriorate. Especially because often respiratory rate is one of the first vital signs to start changing when a patient is deteriorating, and interestingly it is also the vital sign that healthcare practitioners tend to get really lazy about, and we either just guess or neglect it completely, which is not good practice and is unsafe, especially for the patient if it's the first sign that they're deteriorating and we miss it because it's too awkward or it takes too long to take the respiratory rate. So just keep that in mind when you're taking your vital signs, even if you are pressed for time and you're in a rush and you have 5 other patients to see, you need to be taking the respiratory rate correctly just because of how important it is with regards to patient deterioration. So what are our expected parameters for respiratory rate? It differs slightly with different age groups, so we're going to go through them all. I am using the early warning score chart, the maternal early warning score chart, and the pediatric early warning score charts that we have here in Aotearoa that we use in clinical settings, and I have linked these in the description box, which you can then click on and have a look through if you're interested. So for adults, we like to see anything between 12 to 20 breaths per minute. If you have a pregnant patient, we like to see anything between 10 to 20 breaths per minute. If you've got a patient who is a baby, they're between 0 and 11 months old, we want to see a nice high respiratory rate of 30 to 49 breaths per minute. If your patient is 1 to 4 years old, we want to see anything between 20 to 39 breaths per minute. If you've got your patient and they are 5 to 11 years old, we want to see 20 to 29 breaths per minute. And finally, if your patient is 12 years or older, up to about 18, then we want to see 15 to 24 breaths per minute. So children will have a higher respiratory rate than adults, and as you get older, your breathing starts to slow down. So keep that in mind when looking at the different patients that you're looking after. They are going to have slightly different respiratory rate parameters. So while it is important to know the value, how many breaths per minute do they have. It is also really, really important that you look at the full picture. You also need to be observing their work of breathing. So how much effort is it taking for them to inhale and exhale? Are their breaths deep or are they shallow? Are they gasping for air or are they breathing with very little effort? We also want to look at the regularity or symmetry of the breaths, their breathing pattern. Do they breathe in a regular pattern, or are they taking 3 quick breaths and then holding their breath for a really long time and then taking 1 breath and then taking a really long exhale? Is it irregular? You also want to look at the patient's positioning. So are they sitting up quite happily, or are they hunched over, you know, hands on their hips, hands on their legs, tripod position, trying to suck in as much air as possible. You also want to have a look at the patient's colour, especially around their lips and their fingers. You want to have a look at the patient's expressions and any signs of pain. So for example, when they inhale, are they wincing or cringing? Are they guarding their chest, or are they holding onto their sides? Do they look like they're really uncomfortable? And you also want to listen for the sound of their breath. So is it wheezy? Is it kind of whistly? Is it snoring? Is it loud? Is it quiet? So the reason why you want to be observing for all of these things is because it paints the most accurate and full picture of what is going on with that patient. Because sometimes you're going to have patients who may have a perfect respiratory rate, but what that respiratory rate isn't telling you is whether they're in pain or how deep the respirations are. They may have a perfect respiratory rate and then actually be hunched over and in pain, and that's not normal. We take the respiratory rate, but you also have to be looking at the whole patient and picking up on any signs that are abnormal. So now that we know why we take a respiratory rate and what things to look for, let's actually learn how to take one. So how to take a respiratory rate, you are going to watch for 1 full inhale and 1 full exhale, and that makes up 1 respiratory count. So 1 inhale, 1 exhale is 1 breath. So that was how to take a respiratory rate, and that's all we've got time for today's episode of Nursing 101. I really hope that was helpful. As I said before, I link all of the resources that I've used in the description box so that you can have a look through them at your own leisure. Before you go, don't forget to like, subscribe, do all of that good stuff. I will see you next Monday with a new video, but until then, have a lovely day and a fabulous week. Bye!
It's rated X. That means you're extra, extra.